Hi guys, boys and girls, ladies and gentlemen. Welcome to my second episode of Occasional Conversations. Today we're going to talk about depression. We're all very well aware of the detrimental effects that the COVID-19 pandemic brought upon us. It's so absurd that the mental health effects have gone up threefold, probably fourfold. It's just that we don't have the statistics for it right now. But part of the effects, the mental health effects, the grave ones, is depression. We literally, everyone around us knows someone that's battling depression on all levels. So, and I know so many people are wondering, what's depression? How do I deal with it? What do I do about it? So guess what, people? Today, we're bringing on the table, we're dissecting it, we're talking about it. And with me today is the one and only, the incredible Hazel Muriro, community psychologist, mental health enthusiast, proprietor, mindful conversations. So guess what? It's going to be a beautiful conversation. Be attentive, and please know that you can always ask questions. So from our conversation, from our dialogue today, if you have any queries, send them through. We're going to attach our emails because this is a very fundamental conversation and I hope you benefit from it. I know you're wondering, who is she talking about mental health? Does she know what she's talking about? Well, buddy, guess what? I am the ED and co-founder of Conquer Uganda. We're a mental health organization that has a pool of professionals that are 100%, 1,000% dedicated to mental health. So right on it, help me welcome Hazel right now. Hazel, let's do this. Let's talk about mental health. Hi, Hazel.
I'm fine, thank you. How are you, Brenda?
I'm fine. How are you feeling? I'm feeling good.
Feeling well as well. Thank you so much for having me.
Oh, it's my pleasure. Yeah? So let's get into it, Hazel. Let's talk about mental health. What is mental health? Does it mean if I'm depressed I can't work? Does it mean if I'm depressed my value goes down? Yeah. So take the floor, Hazel.
Yeah. So depression.
Yeah.
I think we all know the word, or we are familiar with it in some way or form.
Yes. True.
And as much as it's a word and people usually downplay it and they're like, oh, everyone gets depressed. Depression is normal. You can be sad and you get over it.
Yeah.
I'd just like to talk, to specify that clinical depression isn't the everyday depression. So in terms of mental health, clinical depression is one of the most common disorders, mental health disorders, but it's very much downplayed. In order to be diagnosed as having clinical depression, you have to see a mental health professional.
Correct. Yes.
Yeah.
People, you have to see a mental health therapist to be actually diagnosed with depression.
With clinical depression.
Yes.
So I think I should define it. Clinical depression is an extreme and prolonged form of sadness and sorrow. Okay. That's what it is. So typically we do get sad, we do feel sad, and there are times when we are down, but for clinical depression, you are sadder than usual. It takes longer for you to get out of that sadness and that feeling.
Okay.
Any and everyone could and potentially can suffer from clinical depression.
Everyone.
Yes.
It's not selective of age.
Exactly. So I think one thing I should say is, so often people know that their bodies can get sick. Like they know, like, oh, I could break my hand, I can get malaria.
Yeah.
But we forget and we sometimes ignore that our minds can get sick.
Yes.
So clinical depression is a sickness like any other. Your mind could get sick. You could fall into
Thank you,
depression.
Hazel. Give me a second. Guys, do you understand that? It's very normal. What are we saying? The same way your body gets sick occasionally with whatever ailment, your mind, which is part of your body, also gets sick. So please pay attention to that. It's nothing abnormal or new. It's been there and it happens. Okay, Hazel. So what I want to know from you is, what are the signs and symptoms? How do I know that I'm actually experiencing clinical depression?
Yes.
Yeah.
So some of the signs and symptoms that can let us understand or know when we are suffering from depression, I think one thing I should point out is every individual varies and every individual is different.
Oh, okay.
So these signs and symptoms are not set in stone. They're not a monolith that, you know what, I'm eating a lot, so I must be depressed.
Yeah.
So people are different, individuals are different. So typically anything that's out of character or not the norm can be a symptom for not just depression, but suffering with your mental health, when your mental health is suffering. So some of the symptoms can be weight loss, weight gain.
Okay.
Another symptom could be isolation. Someone could isolate themselves.
Oh, okay. Like they actually set out to be isolated from everyone.
Yes, they intentionally avoid meeting friends, loved ones. They're always locked up in their room. Another symptom for someone else, it could be them being hyperactive and hypersensitive. So now they go out a lot. They go out more than usual, even when they don't feel like it. They want to be surrounded by people. They're partying more. They're drinking way more than the norm.
I've seen that. Like you're sad, but for some reason you want the world to know that, oh my God, I'm happy, so I have people around me. Yeah, so pay attention to that.
There's so many symptoms. So many of them may manifest in a physical way on our bodies or in our behavior. Another important symptom, I think, is insomnia. Yes. Insomnia, lacking sleep, is a symptom of depression.
Okay. True.
Again, stressing that you need to see a mental health professional in order to get a diagnosis of what it is you're suffering.
Thank you, Hazel.
Yeah.
The psychologist has spoken, people. And see, I mean, the privilege is, the beauty is, she's a psychologist. I am the ED of a mental health organization. People do not self-diagnose. Come through, get diagnosed, get the medication, get the treatment. I don't want to speak too fast. So Hazel, tell us, what do you do about depression? What are the remedies?
Yes. So the remedies, as you've put it, there are very many ways that we can deal with depression. And number one being, like we've said, seeing a mental health professional and a therapist.
Yes.
Please see a therapist.
Okay.
I think it's very important for you to see someone who is well versed with the sickness to help you feel better.
Yeah.
As is the case of physical illness, when you feel fever and then after you have general body weakness, you go to the hospital, please see someone who can help you.
Okay.
Number two is having a support system, which I think is so important.
Oh, yes.
That is a very nice coping skill and tool to have, and not just for depression, but anything in life, even typical stress. It's very important for us to have a support system in our lives. It can be a sibling, it can be a co-worker, it can be a friend, it can be a boyfriend. You need to have a support system. You need someone in your life who understands you, who cares for you, who may even notice the signs that we just talked about before you notice them.
Because some people actually suffer from all this and they don't know what they're experiencing, or they're in denial because there are different levels to it. But like she said, it's important that we build a support system. I just keep saying this, a support system then build itself. You can't just be there and expect people to support you. So it starts with you as well.
Exactly.
Build you as you also build.
Just to interrupt, Brenda,
sure.
This is a perfect time to check in on the strong friend.
Oh, yes.
There is that friend who is always checking in on everyone.
Yeah.
She's the one who has her things together. She's the one who seems like everything is fine. Maybe she's like a working mom. She has a job. She has a career. Her kids are doing good.
Yeah.
Check in on the strong friend. The strong friend, check in on her.
I agree. Thank
or
you.
him. Sorry. Check in on her or him.
Oh my God. And on that particular note, people, I want to highlight that mental health does not only affect women.
Yes.
So gentlemen, men, boys, please, let's leave some of these conversations or some things I've been hearing for a long time. Oh, mental health is so muzungu, therapy is so muzungu.
It's a black people issue, it's a muzungu issue, it's
everywhere.
A man issue, it's a woman issue.
Right?
As long as you have a brain, it's an organ in the body, it can get sick.
Thank you. And gentlemen that have to deal with, oh, I'm a man, I can't see a therapist, oh, I'm a man, I can't cry, I can't handle my emotions. That's wrong. That's very wrong, people.
But that's another topic for
another day. Yes, Hazel. So Hazel, like, in regard to mental health, what advice can you give people apart from like seeing a therapist,
having a support system,
and I mean like in lifestyle. Like for example, what small text, everyday text can you give us?
So I think what you mean are called coping skills and tools and mechanisms, also called coping strategies.
Okay.
So these are small little things that you can adapt in your everyday life that will help you cope and deal not just with clinical depression, but any mental health issue you may be facing.
Okay.
Yeah. So there are quite many. A personal favorite, journaling.
Yes.
I recommend that a lot.
Okay.
I think if you document your thoughts, your troubles, your happy moments, it doesn't have to be all in one book or all in one place. It's a very helpful tool to help you cope and to deal with whatever you may be going through.
Okay.
So for instance, my patients, I like to recommend that they have 2 journals. A general journal for when they just want to kind of write down everything, just pour it in somewhere, and then to have a gratitude journal, especially with regards to clinical depression. Because depression is such, your depression makes you dwell more on negative emotions. So you have a prolonged state of sadness. It's important that when you don't have that, you write in your gratitude journal so that you have something to look back at.
Oh, that's nice. That's very nice. And this journal, can it just be a book?
It can be a book. It can be the notes app in your phone. It can be a voice recording, but it's just somewhere you kind of write. Today you feel like, oh my God, I did my makeup so well. You jot that down.
Like I'm
good at makeup. I'm good at makeup. My wig is laid. It's a small little win, but it's a win.
Oh,
it's a small form of joy, but it's little, but it's there.
Okay,
and it's
guys,
important to remind yourself.
Oh, okay. So just by writing, I feel good about it.
Exactly.
Nice,
Especially on the sad days. It's nice to look back and see, because in the moment of despair, you could forget how it feels like to be happy.
Oh
and
yeah,
to be
I can
grateful.
get that.
Yeah.
Oh, nice. Okay, another coping.
Another coping skill, mechanism, and tool that is quite therapeutic is exercising yoga. Exercise and yoga.
I'm an exercise freak. I'm a lifestyle freak. So guys, can I please take over from there?
Yes, please.
People, exercise is not just weight loss. Exercise stimulates hormones that actually help your brain. Oh my God, I'm trying to be as non-technical as it is to a normal layman. So I'll just speak like a layman. Exercise stimulates some things in your brain, good chemicals that make your body, first of all, regenerate, recuperate, and feel good. So guys, work out, please. And for me, I work out in the morning. I wake up in the morning, my alarm goes off, I'm on the road, run down the hill and back up. And by the time I get back up, I've sweated, I feel good, the energy for the day is right. So guys, work out.
So I think one thing I should say, just sorry to interrupt you.
Sure.
When we say workout, we don't mean like what you see on TV or the videos that you do cardio, then you do weights.
Yeah.
You can find what works for you. For me, it's running.
Yeah.
All these sit-ups and squats and they don't work for me. But running, and I go only as far as I feel I can. If I feel tired, I turn back. But it's something that gets me up in the morning. It motivates me. I sweat. Like she said, it activates those feel-good hormones.
Oh. Yeah.
I want you to know that you're not alone.
Oh, yeah.
And I want you to not, I'm very much aware there's a stigma around mental health, mental illness, especially depression. And I just want you to know that getting sick is nothing to be ashamed of. And you can reach out to very many people. You can reach out to Brenda.
Conquer Foundation.
You can reach out to me at Mindful Conversations. We have heart-to-heart spaces. You can even try your local clinic. Nowadays, I've seen clinics and hospitals now have a counselor on site to help people.
Oh no, first cut it short. Guys, we're not trying other clinics. We're coming to our mental health clinic. Yeah?
Yes.
Yeah, okay. Thank you, Hazel. Guys, please, let's educate ourselves. I feel like there's nothing more irritating in today's era. All of you are on the internet. That's that are listening, because you're listening on the internet. So take it upon yourself. Listen to us talking about conversations on mental health and depression. There's nothing as absurd and annoying as stigma on mental health. When the numbers are overwhelming, 1 in 4, 1 in 3 is not a joke. That means literally almost everyone is struggling with a mental disorder. So guys, get out of that bubble and educate yourself, listen and learn, and most importantly, be empathetic to human beings around you. You don't know what has affected people. Yeah, be kind. There are communities that I feel need to know that it's okay. LGBTQ. These are people that are absolutely more prone to suffering depression. I need you to know that at Conquer Uganda, Conquer Foundation, we are one big happy family and we are enthusiastic about mental health. Come through, come to us. We're going to put our details down. And I want you to know that regardless of how you grew up, what you're going through, it's normal. Mental health is affected by social, environmental, and genetic factors.
Yes.
So don't think, oh my God, I'm the only one, or don't hate yourself because of something you don't understand. Please come out, reach us, and if you can't reach us, go on the internet. Don't self-diagnose, but educate yourself. Yeah? So on that very kind note, I need you to know that we're going to keep coming up with more conversations. We're going to talk about suicide next, actually. Thank you, Hazel, for bringing it up.
Yeah.
Our next conversation is suicide. We're going to address it. And we hope that in the near future, everyone is going to know about mental health. Conquer Foundation, Hazel. Very importantly, don't forget to like, subscribe, and click the notification bell, yeah? So keep it mindful on occasional conversations. Till next time, thank you for listening. Brenda Iriama, your amazing host. And Hazel,
Yes.
say bye, say bye.
Bye. Wishing you and your loved ones good health.
Yeah, and stay safe, people. Take care of yourselves. Bye.
Bye.